Hi everyone. I want to talk to you today about acne scars. My name is Dr. Amrika Sheshadri. I am a plastic surgeon and I routinely treat acne scars. So what is acne? It's the pimple problem. And there are so many resource videos on YouTube and on Instagram and on multiple platforms about why acne occurs. Up to 80% of people have experienced this in their teenage and their early 20s, and a small percentage of people have experienced this in their adult lives. And the adult form of acne tends to be a bit more severe, and more about that later. How do you treat the scars that occur after acne has resolved? So you no longer get pimples, or maybe you get like the occasional pimple here and there, but every time it goes away, it leaves a crater in your face. So there are three types of scars that occur here. One is the rolling type of scar, where it looks like gently undulating skin and there's a depression and then it comes out and then depression again comes out. These are called rolling scars. And there are box scars, where it's like there is a bit of normal skin and then there is a deep depression and then there is another bit of normal skin. So these tend to be very depressed scars. The third type are ice pick scars, where they are large or small scars which look like someone's poked needles into the skin, and that's where it's stuck. So in order of ease of treatment, rolling scars, my favorite, easier to treat, not easy to treat. Second is box scars, and third are ice pick scars. And today I want to talk to you about one of my patients has very kindly consented to social media, so I'm going to be using his example as to give you an overview of how I treat acne scars. So case in point, here's a very nice gentleman. He's young, he's otherwise healthy, he's had nodulocystic acne, which is a very severe form of acne, and although the acne part has resolved, that is to say he's not getting active pimples, he has this very rough, very gone in kind of face texture that has occurred because of the side effects of what happens when you get a pimple. So the skin is completely scarred up, he's lost hair in patches along his jawline, and especially at his temples, it looks like, he's been poked repeatedly with a needle and poked repeatedly with punches, so that everything has gone in. After giving anesthesia, so the anesthetist makes the patient mostly asleep. This is called IV sedation, and I go ahead and put a small cut in the hairline. So I'll show you the instrument that I use for this. Is my fat grafting set. I've just broken the seals. I can't believe I'm about to open sterile material while I'm recording, but I'm going to do this for this video. So inside is another package. So these are double layered packages, and then there is this steel box inside which I have my instruments. So this is one of the instruments I use to liberate the scar. This is the Taylor Liberator, and what I use is this end. It's a 2 millimeter instrument. I use it to go from the hairline here, and then I slide it under the skin and lift the scar. So it's got very nice prongs at the end, and I use this to literally lift the skin off of the scars from the inside. So on the outside, nothing is visible, it's all on the inside, and this video is showing you how I do this. And so what that does is it frees up the scar tissue from the depth, so that it comes and lies, there is a smooth, here is the skin, and then here is the deeper layer, and so this has created a plane there. Now when there is a space like this, it typically tends to either go back and get stuck, or it swells up and stays swollen, but neither of which we really want. So what do? I use fat graft. That is to say, I extract fat from the abdomen or the thighs and I refine it. And I'll show you what I used to do that. I'll show you what things I use to refine the fat as well. This is a Tonard harvester. It's a very slim rod, and this is what I use to harvest fat from the abdomen or the thighs to take it out of the body, and then there's a syringe on this end, so it just gently pulls it out like that. And then I use the tulip system. So I love this, I love the brand, not being sponsored by them unfortunately, but a big fan of the system. So this is the original tulip system that I have, and I have 3 different these are things that allow me to size the fat. So fat comes in sort of clumpy things, so I run it through this, and then I run it through these. So these are the filters which let me determine what size I need the fat to be. I typically don't use the purple one. This is the 1.4 and then I use the 1.2. And the 1.2 is what gives me the nano fat, and it's amazing. It's this creamy substance. It's a beautiful filler. It causes absolutely no reaction. It does not swell later on. So I tend to overfill so that even if it deflates a little, it's still there. I expect 30% loss of volume after the procedure. So I tend to overfill so that, I compensate for that loss. Now, how is the fat delivered? It's delivered through these very, very pretty needles. Actually, they're completely blunt. Like I could try and poke it through my palm. It's not going to go in. So these are cannulae. These are not typical needles. These are hollow, apparatus, and then you can try pressing through it. It's not going to go through. So what is given is through this. So it goes through the same cut and then it delivers the fat all along. It goes through to the same thing. And what this does is that it gives this beautiful filled feeling to the face. The face becomes like a baby face with a big layer of subcutaneous fat, which is what really gives it its youthful quality. And so at the end of it, there are a couple of stitches that are placed here with 7-0 or 6-0 sutures, and so these do not leave a scar typically. Now, after surgery, do expect a lot of swelling to be there for the first 72 hours. There'll be some restrictions like do not lie down flat, etc. But these are very small restrictions. There are no specific food restrictions, etc. And medication is given and then you're sent home. And so what does this look like 3 days after surgery? This is what it looks like 3 days after surgery. I'm going to put a picture next to it so you can see the before and then the after. And you can see how smooth that is, how beautiful that texture is. So the next question is, how durable is this? This is the same thing. So this is the before and this is 3 days later. And what does it look like when the inflammation has settled and some of the fat has resorbed? This is what it looks like at about 1 month's time. So this particular gentleman did not need any immediate procedure right after the fat grafting, because with this, his entire face is glowing, it's looking a lot healthier, and it is truly regenerative medicine at its best, because what was lost to him, which is the normal softness of skin, has been completely restored. The fat is lost due to acne scarring, and now we are raising up the scars, creating a space and putting fat in there. And there can be no finer example, at least in plastic surgery practice, for this kind of amazing result in one sitting. What are the other things that are done typically during this kind of procedure is that some people do a light dermabrasion, or we can use fractional carbon dioxide laser, and MNRF can be done, a chemical peel. Now this is actually my favorite. I love doing a chemical peel during this procedure if the patient has suitable skin. The thing is, with this kind of acne scar therapy, everything is customized. There is no one size fits all for any patient. So should you undergo surgery? I mean, doesn't that seem a little extreme to undergo surgery for acne scars? Yes and no. So if you want a definitive therapy for acne scars, surgery is one of your best options. Instead of wasting thousands on products that are promising you to remove scars and then they just leave you with the same scars, if not harming your skin. This is what I said, evidence-backed. It is evidence-based medicine and regenerative medicine at its best. If you have slight scarring, you may not need subcision and fat grafting. If you have rolling scars especially, you will really benefit from it. Box scars, plus or minus. Ice pick scars, I'm going to have to make another whole video about that, because the scope of that therapy is a lot different from what we do for rolling and box scars for patients. But I hope you enjoyed this video. I hope that you got a lot of info out of it. Please don't forget to share, like, and subscribe. And if you want more details about how your acne can best be treated, just drop a comment down below in the comment section, and we'll be happy to help. So have a good one.